There is nothing surprising here, so I'll not take the time to read the diagnostic criteria to you. These people don't just appear out of nowhere. Every teacher knows at least one child who seems destined for trouble. Usually the causes are not mysterious. Little 8-year-old Charles comes to school. It is 20 degrees and he's wearing a t-shirt and no jacket. He smokes cigarettes, swears at the teacher, and all the other children are terrified of him because he is cruel and mean. His parents cannot be reached. No one knows what to do with him. He hangs around with children who are much older than he is and extorts money out of children his own age. There are reasons to believe he uses and sells drugs. What to do? Wherever Charles is, you'll find some sort of trouble. Time passes and many opportunities are missed. Charles has moved on until one day you read about something terrible he has done. It is too late now, and Charles, and many more like him, will end up doing multiple life sentences in prison. Or he might serve 30 years in 5 or 10 year installments. By the time Charles gets in prison, there have been many school teachers, school principals, social workers, and others who watched this train wreck in slow motion and never had any idea about what to do. It appears common knowledge that when nothing changes, nothing changes. Some places are considered to be just too slippery and are banned on many probation agreements, and success will call for a lot more than just changing playmates and playgrounds, as they say in Alcoholics Anonymous. But even the famous 12-step programs have mixed results at best with dealing with APD. On the other hand, factors such as criminal cohorts and practices which are linked to previous criminal activity are avoided. This quite often necessitates a complete change in what are called playmates and playground. For the first time in 30 years, there is hope now. Despite 30 years of expert opinion to the contrary, of everyone saying that nothing works in correctional rehabilitation, Canadian experts including Don Andrews, James Bonta, and Paul Gentry have found a solution that works for rehabilitating offenders of all stripes. Despite all the disparaging beliefs of the mid-70s until recently, treatment with offenders has consistently shown to be effective in changing criminal behavior, thinking processes, and there are very real measurable data that show positive quantitative and qualitative differences in an offender's behavior, including recidivism rates, satisfaction with life, and decreased potential for harming others, with a few of the following essential prerogatives. These Canadians have come up with some basic ideas about what works and, most importantly, what does not work in the treatment of criminal recidivists. Predictably, they call this system of practices and convention what works. There are now distinct conditions for what's called successful treatment. Firstly, the intervention is undertaken by the correctional system. Secondly, it is planned. It does not occur by chance, but it is designed to have specific features and goals. The intervention targets for change the factors that are causing the offender's criminality. These factors may be internal, such as the thinking process, or in the offender's social environment, such as he lives in a slum or has no education. Regardless, the purpose of the intervention is to change these features. And the intervention's main goal is to reduce recidivism. This might be good for the offender, but is also critical in protecting the public. And, by chance, the intervention may also help to improve the offender in other ways, such as making him or her more educated or psychologically healthier, but he will not be merely a more educated or healthier criminal. He will change his behavior. Cognitive behavior programs focus on two key things. First, they try to restructure the thinking processes, the distorted or erroneous cognitions of an individual. These are sometimes called thinking errors. And they try to assist the person to learn new cognitive skills, new ways of seeing things, new ways of behaving and reacting to other people. Offenders tend to have minimum cognitive skills as to how to behave in a pro-social manner. For this reason, cognitive behavioral programs attempt to assist offenders to 1. Define the problems that led them into conflict with authorities. 2. Select goals and to generate new alternative pro-social solutions. And then to implement these solutions. A cognitive behavioral program with corrections would involve the following steps. The predominant antisocial beliefs of the offender in question are identified. In a firm yet fair and respectful manner, it is pointed out to the offender that the questions and belief are not acceptable. If the antisocial beliefs continue, emphatic disapproval, such as withdrawal of social reinforcers, such as awards, tokens, or whatever, always follow. They might lose their leave privileges for the weekend. And meanwhile, the offender is exposed to alternative pro-social ways of thinking and behaving by concrete modeling on the part of the therapist in one-on-one sessions or in a structured group learning sessions, such as courses in anger management. Gradually, with repeated practice and always with immediate application of reinforcers, wherever the offender demonstrates pro-social belief and conduct, the offender's behavior is shaped to an appropriate level. And there are 3 principles for effective intervention. The first principle is that intervention should target the known predictors of crime and recidivism for change. That should target what makes the criminal offend. This is called the needs principle. The second principle is that treatment services should be behavioral in nature. This is called the responsivity principle. The basic reason for this is that no two offenders are alike, and their treatment should match their unique characteristics. For somebody of a lesser IQ, a cognitive behavioral would not be appropriate, such as a more concrete treatment plan. Third, treatment interventions should be used primarily with higher risk offenders, targeting their criminogenic needs or dynamic risk factors for change. This is called the risk principle. Basically, it means that by placing a high-risk recidivist in a more watered-down program, you'll find these more jaded offenders capture or take advantage of other participants in the low-risk program, making for and serving to actually increase recidivism among the other offenders. On the other hand, If you take a low-risk offender and put him in with a bunch of higher risk or more jaded offenders, he will be cowed by the more aggressive, high-risk offenders, or learn the ropes to becoming a more serious criminal. Programs that are not related to criminal behavior, such as boot camp or religious institutions, do not target criminogenic behaviors or needs and are not stressed. And this is a list of my citations for this report. Thank you very much.